Post-traumatic stress disorder, anxiety, and depression can lead to substance abuse. There are many youth in the city of Baltimore who unknowingly suffer from PTSD and anxiety-related issues that lead to substance use. PTSD is defined by the Substance Abuse and Mental Health Services Administration as a real disorder that develops when a person has experienced or witnessed a scary, terrifying, or dangerous event. In urban communities, this could include sudden death of a loved one or being exposed to violent crimes and living conditions. PTSD is linked to a wide range of health conditions. Depression and substance use disorders are common. Substance use, as defined by the Center for Disease Control and Prevention, refers to the use of selected substances, including alcohol, tobacco products, drugs, inhalants, and other substances that can be consumed, injected, or otherwise absorbed into the body, possible dependence, and other detrimental effects. Substance abuse, defined by the American Psychological Association, is a pattern of compulsive substance use marked by recurrent, significant social, occupational, legal, and interpersonal adverse consequences. Baltimore has had a standing conflictual history with violence, substance use, and addictive drug abuse. From heroin's beginnings in the 1970s, the crack epidemic in the 1980s, to pills and opioids, and more recently, the legalization of marijuana. 1 in 4 children and adolescents in the United States experience at least one potentially traumatic event before the age of 16. More than 30% of 17-year-olds, or 1 in 8, have experienced PTSD at some point in their lives. 1 in 5 American adolescents between the ages of 12 and 17 engage in abusive or dependent or problematic use of illicit drugs or alcohol. Studies indicate that 50% of young people with PTSD subsequently develop substance use problems. According to the Institute of Drug Abuse, the percentage of adolescents reporting substance use in 2002 largely held steady after significant decline in 2021. This reported use for almost all substances decreased dramatically in 2020 to 2021 after the onset of COVID-19 pandemic and related changes to school closures and social distancing. 2002 results show that nicotine vaping, cannabis use, alcohol use, and any illicit drug use other than marijuana all remain stable. In the last year, among 12th graders, 23% report vaping nicotine, 31% report cannabis use, with 20% reporting vaping cannabis. 52% reported alcohol drinking, and 8% reported using any illicit drug other than marijuana. However, the use of narcotics other than heroin, including prescription drug use, increased slightly 1.7% between the years 2021 and 2022. The national statistics are based on surveys given annually to students in 8th, 10th, and 12th grade who self-report their substance use behaviors over various periods of time, including the past 30 days, 12 months, and their lifetime. Although the data indicates stable usage, the research reports a dramatic rise in overdose deaths in youth people aged 14 to 18, and this is attributed to the illicit drug fentanyl, a potent synthetic drug contaminating the supply of counterfeit pills made to resemble prescription medications like benzos, ADHD medications, and opioids. Oftentimes, these drugs are purchased through social media platforms provided by a friend or purchased from an unknown source. Teenagers in Maryland are 1.7% less likely to have used drugs in the last month than the average American teen. 8.1% of 12 to 17-year-olds reported using drugs in the last month. Among them, 86% reported using marijuana in the last year. 2% report misusing pain relievers, and 9% report using alcohol in the last month. Maryland adults ages 18 to 25 are 8% more likely to use drugs compared to the average American in the same group. In Baltimore, 3.8% of women had PTSD symptoms as compared to 11% of men. 31% of children in Baltimore have experienced 2 or more adverse child experiences. These experiences can include domestic violence, living with someone with a substance abuse problem, death of a parent, or witnessing or being a victim of violence. Teens may use alcohol and drugs for many reasons. They may do it because they want to escape their problems. For example, some teens use drugs to try to avoid the symptoms of mental health conditions such as attention deficit hyperactivity disorder or depression, ease feelings of insecurity related to post-traumatic stress disorder, or forget the past trauma or abuse. Individuals living in poverty may have access to few resources that could serve as protective factors against the development of PTSD symptoms. Direct predictors of adolescent drug use are low parental monitoring, poverty, poor neighborhoods, adverse school conditions, and negative family or peer influences. In Baltimore, 24% of people living below the poverty line compared to 9.9% of people statewide. Poverty has been in a rise in Baltimore children, which can be linked to an increase of undiagnosed PTSD. In 2021, Baltimore youth ages 14 to 17 made up 21% of the population, and the child poverty rate of this age rate was 35%. Nearly 1 in 3 young adults lived in poverty. Youth living in poverty have higher rates of adverse child experiences and increases likelihood of early initiation of illicit drug use. Development of an effective treatment plan relies heavily on patient participation. Early engagement in treatment is associated with better participation in treatment and establishment of therapeutic relationships. Long-term goals to treat PTSD and substance use are to stop using substances, restore confidence and self-esteem in decision-making, identify and address potential triggers, develop healthy coping skills, introduce alternative and substance abuse to substance abuse, repair and restore potentially damaged relationships. Short-term goals to treat PTSD and substance abuse are identify feelings that link them to triggers, relieve symptoms associated with PTSD, find a support system, and attend Alcoholics Anonymous or Narcotics Anonymous meetings. Drug interventions should focus on the problematic aspects of personal risk factors. Therefore, addressing the fundamental contributing factors may be beneficial. When intervening with youth, emphasis should be on school performance, prevention programs, social skills training, social and emotional learning, parenting programs, and support groups. Cognitive therapy is often used along with exposure therapy to treat PTSD. Trauma-focused cognitive behavior therapy is also an effective treatment. Cognitive interventions include reframing the mindset of the individual, replacing unhealthy thoughts with more helpful and productive thoughts. To address the concern of substance use, it is important to focus on education of drug use and setting and achieving obtainable goals for the individual. My belief is that PTSD and adolescent drug use have a direct correlation to one another. As a social worker, my plan will be to address the underlying problem in order to further address the presenting problem of substance use and PTSD. My plan is to focus on initially addressing the adverse childhood experiences. After improvements in that area, the next step will be to devise a plan that focuses on current concerns and recommendations for substance abuse programs along with relieving the symptoms of PTSD. My name is Ginger Williams, and I'm a graduate student at the social work program at Morgan State University.